Number 1, AB 1020, Ms. Friedman.
Good morning, Mr. Chair and members. I want to thank you and your staff for all your work on this bill over the last couple of weeks, and I'm happy to accept the amendments outlined and the analysis on page 12. 15 years ago, our predecessors in the legislature passed two key reforms to protect Californians at risk for financial devastation. Both the Hospital Fair Pricing Act and the Fair Debt Collection Practices Act were designed to provide basic consumer protections in debt collections and to also increase patient awareness for free and discounted medical care for which they are eligible. Hospitals in California under current law have to provide charity care to patients who receive medical services and are uninsured or underinsured. This consists of full payments or partial payments depending on their particular situation. The Hospital Fair Pricing Act provides the minimum guidelines that hospitals have to follow when they offer this charity care, as well as how they can go after any unpaid debt. And debt collectors in California also have to follow the same rules. It also provides protections to patients throughout the collections process that include things like a 150-day time period before a hospital or collection agencies can report their account to a consumer reporting agency or to start civil actions against the patient. However, despite these protections and despite the law, there are hospitals in California that are not following these rules, that are not telling the patients about their eligibility for charity care, and that are also sending their information right off to collection agencies, which is devastating to the patients. Kaiser Health News reported in 2019 that nonprofit hospitals in California could have, but did not, provide $135 million in charity care to patients. Instead, they went after these patients who are unable to pay for those supposed debts. The patients report being discharged and receiving medical bills without knowing they were actually eligible for Medicare or how they could apply for charity care. To address these gaps and to protect these very vulnerable people who are not only economically disadvantaged, but a lot of times are at the worst time of their lives because they've been sick. So they're really not able to fight this system. So this bill will strengthen the state enforcement and oversight of the Hospital Fair Pricing Act by penalizing hospitals that don't follow the law. It will provide patients with more detailed information about their bills and about how they can apply for public programs like Medi-Cal as well as charity care at the time of discharge and also when the bill is sent to collections. It prohibits hospitals from selling patient data, something that too many of them are still doing. Selling patient debt. It extends adverse credit reporting and commencement of civil actions from 150 days to 180 days after initial billing. So remember, a lot of times people are laid up and not even able to open their mail. Requires debt collectors to certify that the patient has been screened for public programs and financial assistance before they file a lawsuit. And it raises the income level for financial assistance from 350% of the poverty level to 400% of the poverty level. For the past few weeks, we have been working with the California Hospital Association to address any concerns that they might have. And we have agreed with them on a basic framework for compliance, and we'll continue to iron out details as we move the bill forward into Assembly Health. Testifying in support this morning are Tracy Douglas with BedSedec Legal Services and Monique Davis, who's a patient who wants to share her story with you today. I appreciate your thoughtful consideration, and I urge an aye vote. Thank you.
Thank you, Ms. Friedman. I have 3 witnesses listed. Tracy Douglas of BedSedec, Monique Davis, an individual, and Jen Flory from the Western Center on Law and Poverty, they're all 3 on the telephone. Ms. Flory is available for questions. So we'll start with Tracy Douglas.
Good morning. Thank you, honorable members. BedSedec is a nonprofit legal aid organization, and we are proud to co-sponsor AB 1020. As reports make clear, California hospitals are not providing charity care when they could and are also not telling patients about its availability. Medical debt has devastating effects. It can send people into poverty. They can lose their housing through eviction and foreclosure. The stress from debt piling up and collection calls sometimes worsens health, and at worst, they can be forced to file for bankruptcy. Medical debt is the leading cause of consumer bankruptcy. AB 1020 provides consumer protections for patients in a number of ways. It increases eligibility to 400% of the federal poverty line. It requires notice of financial assistance policies by hospitals and debt collectors to patients. It requires debt collectors to show that a patient has been screened for financial assistance when filing a lawsuit, and it bans the sale of medical debt to debt buyers so that hospitals retain control over the debt. My clients who have faced huge bills are seniors who had emergency care or needed surgeries for a condition. At no time did the hospitals ever let them know about charity care. They were fortunate enough to be referred to legal aid for help. Patients should not need an attorney to tell them about financial assistance as an option. The financial assistance process should not be opaque and hard to get. It should be readily available. BetSedic is not the only legal aid organization noticing this problem. My colleagues from other legal services report seeing the same issues. Hospitals are continuing collections during the pandemic, and we can expect that medical debt will increase. The time has come to strengthen the Hospital Fair Pricing Act so that even those who don't have an attorney benefit from it as intended. For these reasons, we respectfully request your aye vote. Thank you.
Thank you. And next we have Monique Davis.
Hello. I live in Assembly District 65 and Senate District 32. In November of 2017, I was diagnosed with a rare bone marrow disorder. I had never been sick before, and I was at the prime of my life and career. I was treated at over 5 separate hospitals before I was at the 5 separate hospitals and received chemotherapy and a stem cell transplant that was required. Multiple times I was rushed to the hospital in an emergency. Each time I was admitted and stayed at least a week or more. I was seen at UC Irvine, La Palma Intercommunity, Memorial Care, Orange Coast Medical Center, Anaheim Regional, West Anaheim Medical Center. I was very deathly sick for over a year and a half, in and out of hospitals and not receiving correct treatment, each time being sent home without the proper diagnosis and accumulating more and more medical debt. I could not work. My husband had to take temporary leave or miss work to care for me. While at Memorial Care, they told my husband to borrow money from family members and pay out of pocket before they would continue my treatment. None of the hospitals informed us of any potential financial help. We started to receive numerous hospital bills in the mail and phone calls. They would call me while I was still in the hospital. They would call my husband at work and demand payments. We were scared, felt alone, and terrified. At times, I thought maybe it would be better if I had died. Then my husband would not have the added stress and financial burden of me. The bills mounted and the calls increased, and they turned us over to collection agencies and reported negative credit activity. This has impacted my ability to gain new employment as a nonprofit supportive housing and social services executive. Was it my fault I became ill? Is it more money more important than my life? It was not until I contacted Public Law Center that I found out that I should have gotten help with the hospital bills to reduce my bills or offer me a payment plan. Thank you for your time and consideration of Bill AB 1020.
Thank you. And would you identify yourself for our record, please?
My name is Monique Davis.
Thank you. Thank you. All right. So we will now move to support on the phone lines. I don't see anybody in the witness video room. Operator, you could open the lines for AB 1020 for members of the public who wanted to give us their name, their affiliation, and their support of AB 1020.
Thank you, Mr. Chair. Ladies and gentlemen, if you wish to speak in support of AB 1020, please press 1, then 0. An operator will provide you with your line number and place you back into queue. Once again, if you wish to speak in support of AB 1020, please press 1, then 0 now. And at this time, Mr. Chair, we have 3 people in queue.
Thank you.
Line number 56, your line is open. Please go ahead.
Good morning. Yasmin Peled with Health Access California in strong support.
Line number 36, your line is open. Please go ahead.
Good morning. Camille Nguyen with the Legal Aid Society of San Mateo County in support.
Line number 33, your line is open. Please go ahead.
Good morning. This is Lee Theron with the Public Law Center, one of the co-sponsors of AB 1020, calling in support of the bill.
And at this time, Mr. Chair, we have no one else in queue.
All right, thank you. We will move to opposition. I have one opposition witness noted, and that is Barbara Glazer from the California Hospital Association, who is with us on the telephone. Good morning.
Good morning, Mr. Chair and members. Barbara Glazer with the California Hospital Association. We do have a position of opposed unless amended. However, CHA does support many of the changes proposed in AB 1020, such as increasing the eligibility for charity care from 350% to 400% of the federal poverty level. We appreciate the amendments being taken today in committee. They do deal with some of our concerns. We have some remaining issues having to do with overlapping regulatory authority and the level of the fines, but we look forward to continuing our work with the author's office and the sponsors, and I feel confident that we can resolve these differences to remove our opposition. Thank you so much.
Thank you. All right, we will now open the lines for anyone member of the public who would like to speak in opposition of AB 1020. Operator.
Thank you, Mr. Chair. Ladies and gentlemen, if you wish to speak in opposition of AB 1020, please press 1, then 0. An operator will provide you with your line number and place you back into queue. Once again, if you wish to speak in opposition of AB 1020, please press 1, then 0 now. And at this time, Mr. Chair, we have no one in queue.
All right, thank you. I'll bring it back to the committee. Questions or comments? Mr. Kiley?
Good morning. So my understanding is that you're eligible for charity care, excuse me, if either you are uninsured or have high out-of-pocket costs and you are insured. Do you know, or any of the witnesses, sort of, what's the more common situation in which charity care is used? Is it for the uninsured or for the insured?
I don't have that information. Maybe the Bet Sedek witness might know.
This is Jen Flory. I can speak to that issue from Western Center on Law and Poverty. We do find that more often patients who are uninsured are screened for charity care, but not all of the time. It can be harder to identify underinsured patients, but particularly patients who have high deductible health plans. Often what they need is just a reasonable payment plan, which is also part of the Hospital Fair Pricing Act. And so if they had that information and they knew how to get that payment plan, they would be greatly benefited.
Okay, so I guess I believe under California law now, or at least as of this year or last year, you're actually required to be insured, and if you don't get insurance, then you're penalized for that. But then we also have a policy where you're given reduced, costs if you are not following that mandate and go to the hospital. So I'm just trying to get my mind around how these policies sort of fit together.
Well, I certainly can't speak to every case. It is my understanding that there are many individuals who don't understand that there's health care that's affordable for them, or that they're eligible for Medicare or Medi-Cal. And sometimes it's a question of the hospitals providing that information and helping them sign up, and that's something that many of these hospitals are not doing. They're not helping them navigate that system to get the insurance. But if you're asked, as to why somebody might know about insurance and not have it, sometimes they maybe feel that they can't afford it, even with the subsidies. I have found just anecdotally that when I've told people about the subsidies that are available under California, a lot of times people had no idea. They had no idea the amount of subsidy and that there was insurance out there that they were eligible for that's affordable. So I think those are sometimes the people who find their way into this situation. But I'm just guessing. I don't have the one-on-one experience that Western Center might have. They might give you a different answer.
Yeah, that makes sense to me. Did you want to add anything, the witness on the phone?
I would say all of those things are absolutely true. And then even for people who are insured, when they lose their job and they lose their insurance, it can take some time before they get into a new program.
Okay, that makes sense to me. I'm going to support your bill. I just want to kind of point out, in some sense, the irony that we're providing this relief, but then at the same time we're sort of financially punishing these very same people if they don't comply with the state's mandate. So that might be something we want to look at some point.
Thank you. Thanks for the question.
Well, and we also know that even though there is a mandate, we know that we're not covering 3 or 4 million people in California. So there is not complete coverage for people in California who may be subject to this. So.
Sorry, and that gap is large. I had Blue Cross years ago, a pretty good insurance plan, and when I went through a year of chemotherapy, I ended up with $10,000 in debt. And it was not possible. I mean, it was really hard for me to pay that. So even people that have supposedly good insurance going to have very high out-of-pocket costs.
Mr. Chow.
Yeah, I just want to gauge the size and the magnitude of the problem. Now, maybe a couple of follow-up questions for the witnesses. First of all, the Act, that is the this particular law, the Hospital Fair Pricing Act, applies to both nonprofit hospitals as well as for-profit hospitals. Is that correct?
I believe so.
Oh, okay. Yes. Now, it's been cited that in 2019, the amount of the debt incurred by the nonprofit hospitals was that could have been provided to patients was $135 million. So I'm just wondering what the dollar amount was for, let's say, for-profit hospitals.
I don't have that information at my fingertips. It's an excellent question. I'm assuming that they were just studying this particular cohort of hospitals in this particular study. Yeah. I will ask if any of the sponsors happen to have that data available, or if we even know.
This is Jen Flory. I don't have the exact numbers available, but the data is there, and nonprofits and for-profit hospitals are actually very similar in how they are both providing charity care and the amount of charity care that they're leaving on the table.
Yeah, and the $135 million, was that just for 1 year, the 2019?
That was just for 2019,
okay.
And just for the nonprofit hospitals.
Got it. Okay, thank you.
All right. Other questions, comments? Ms. Davis.
Thank you. Thank you. Question, I just want to clarify that this bill allows a penalty against the hospitals if they bill the patient wrongly and doesn't allow them to appeal. Is that correct?
Well, we're still working on what the actual penalty part of this will be. That's what we've been talking to the Hospital Association about. We certainly wanted to make sure that they have a real reason to follow the law, have enough of a penalty to make them think twice, and to set up formats in their own hospitals for compliance to really make sure that this information is being provided to patients. Our goal is not to be punitive. It's really to get the hospitals into compliance.
And I understand their concern on that. Also, do we have an idea of what kind of penalty it would be? And if so, where does that penalty go and how's it used?
We're looking at a sliding scale. So the first offense, of course, would be much lower. And then the maximum offense, we're talking about numbers around the $25,000 mark. And I will just say that it's hard to put a penalty number on an action that could literally ruin someone's life. When a patient feels that they'd rather be dead than put their family through economic ruin, if someone's house is taken away, if they are unable to get a job, if they can't get a loan anymore for their child because of medical debt that they shouldn't have accrued in the first place, it's hard to say what the fair number is for the hospital. But that's what we're working with the Hospital Association on.
Perfect, and I think that's my concern is, everybody makes mistakes. So I'd hate to see, a fine come against someone that accidentally made a mistake when they were billing something. And, if they'd actually have an opportunity to appeal, to be able to prove that, it wasn't intentional.
I totally understand the concern, and I agree with you. Sometimes things slip through the cracks. But if you have $135 million in 1 year just from your nonprofit hospital sector, this is something that clearly the hospitals need to systemically look at their processes. And so it looks to me as though they don't have the right mechanisms just in place to make sure that every single patient who deserves this relief is getting it. So hopefully this will push them to set up those much more robust sorts of procedures and make this much more routine for them to check for this the same way they'll check if you have a fever or if you have an infection before you leave the hospital. They should be checking to make sure you can pay your bills.
And forgive me if you've answered this again. Where would this penalty go to?
That I believe would probably, I'm going to have to double check what's in the text of the bill, but I'm assuming it would go to the agencies the way that these normally do to continue to administer the program.
Okay. Thank you. Appreciate it.
Thank you. Thanks for the questions.
Mr. Gallagher.
Yeah, thank you to the author, and I appreciate the issue. I mean, I was one of the legislators who stood up to end surprise billing, when the bill actually failed the first time. And so I'm certainly one who has fought on this issue and is concerned about hospital debt. I think there needs to be more transparency in pricing when it comes to healthcare. But for me, on this particular issue, I think there's already a lot of protections in place. For instance, we have 350% of poverty level is eligible for charitable care now. And we have procedures in place that help ensure that those things are followed. There are, what I'm concerned about with this bill is it adds a private right of action, which we know will again be a tool for attorneys to sue hospitals, to cost them additional dollars. There's a lot on this front, and my concern especially is for rural hospitals, who in my district have been through hell during COVID-19. First, with the initial surge in shutting down the hospitals to elective procedures, which nearly killed many of my rural hospitals. And I think it's still an open question as to whether or not they will recover. Then to add additional potential liability, potential lawsuits, if they don't follow every iota and give the exact notice that's required, the more we keep adding these kinds of things in place, when again, there already are a lot of protections in place for charitable care. There are already a lot of provisions in place that help to ensure that there's not surprise billing. Again, this legislature helped ensure that happened. Against many in healthcare stakeholders who did not want to see that happen. But I just feel like in this area there's already a lot of protections in place, and I don't want to put an additional liability burden upon hospitals that are already having a hard time making it through as it is. And if there is no hospital in some of my areas, that means people don't get care. That's going to be a much greater threat to their health care than what we're talking about here.
Well, thank you for the concerns, and certainly they're very valid concerns. And I do want to point out also that the amendments today did put an appeals process in, so the hospitals do have a way of appealing and saying, so we have this great system, it's just, the paper got jammed in the printer or whatever it is. They can show that there is a way that they can appeal any fine. And again, the fines would start at a low level and increase. And I will just say this. Having protections for consumers are not protections if the consumers are not notified by the hospitals that they exist. If you have people who are vulnerable, who are sick, who are maybe gone through the worst week of their life, who are at a point where they're not able to find this stuff out for themselves or to go hire a lawyer, these are people who are low income, who are clearly in a very vulnerable state, the hospitals have got to take it upon themselves to make sure that those people understand those protections. If they don't do that, the protections become irrelevant. So that's what this bill is trying to do, is saying we have a problem here. We have our free legal aid providers saying we have a problem. These people, the lucky ones, are finding their way to us, and then we can help them. But how many more are just going bankrupt? How many more are losing everything when the protections that you had set up and that the legislature set up is right there waiting for them? If they can't access that, if they're not told about it, they're not just going to find their way there. So that's what this is about. It's not about being punitive to the hospitals. It's saying 2019, a report was done showing that this care that people were eligible for was not given to them. They've had now 3 years to fix the problem. They haven't moved, and even the Hospital Association is saying they agree that this bill is necessary, and now we're just talking about how do the penalties work so that they're not punitive. So we're going to continue to work with them. And we want to make this workable for our hospitals. We want to be in partnership with them, but we also want them to make the systemic changes that they need to protect our residents.
And might I address a couple of Assemblymember Gallagher's specific concerns?
No, there was not a question in that. There was a statement.
Okay.
Thank you. And I don't see any other questions. Can we take that as your close, Ms. Friedman?
Yes, thank you.
All right. Thank you. So I'm still looking for a motion and a second. So we do have a motion and a second. That motion is do pass as amended to Health Committee. Call the roll, please.
Stone?
Aye.
Stone, aye. Gallagher? No. Gallagher, no. Chow? Aye. Chow, aye. Chu? Davies?
No.
Davies, no. Gonzalez? Aye. Gonzalez, aye. Holden? Aye. Holden, aye. Kalra? Kalra, aye. Kiley? Aye. Kiley, aye. Mainshine? Reyes? Aye. Reyes, aye.
Thank you all.
That bill is out. Thank you.